A pharmacist. I've been specializing in medical cannabis since 2015. I started off in the dispensary space, and now I'm in private practice with two open-minded medical physicians. We're collaborating on their cases, they're collaborating on mine, so it's a really nice continuity of care. We really just wanted to talk today and share about what it is that we do so we can inform more people and you can tell more people about the potential for healing with cannabis and different ways to use it as medicine. So I think oftentimes we automatically think it's just about like smoking pot and using THC, but there's been so much science, there's so much experience now with different cannabinoids and different delivery systems. We're really using cannabis for disease states and symptoms that we weren't using it for, 10, 15 years ago. So I feel like it's a responsibility that if someone can finally find relief after maybe decades of struggling with rheumatoid arthritis or fibromyalgia and doing lots of different medical procedures or surgical interventions and lots of pharmaceuticals and not getting that relief and feeling so frustrated and all of that emotional burden, that there is an alternative. So really letting people know that this is out there and there are people like us who want to help you and have the know-how to do so. Do you want the next one? Sure.
Hi guys, so I'm Paulina Nicholas. I'm a nurse practitioner. I have my doctorate in nursing. I'm the owner and medical director of Higher Med. We are a clinic in downtown Plainville specializing in alternative health, primarily cannabis medicine, but we also do some CBD skincare and just ways to kind of incorporate natural medicine into your health practices, I suppose. My background is in primary care, so I worked as a primary care nurse practitioner for a large federally qualified health center in Connecticut for about 8 years. I was actually the medical director for their healthcare for the homeless program. And in my role of serving or working with the homeless population was when I was first kind of exposed to people using cannabis for medical purposes. And really just seeing those patients being able to come off of some of their pharmaceutical medications, controlled substances, led me to delve deeper into cannabis as medicine, and that's kind of where the concept of Higher Med was born. And so that's what I've been doing for the last 2 years part-time. I also work in endocrinology, doing advanced diabetes management with Hartford Healthcare.
Hello everyone. Thank you for being here. Thank you to the panel. This is a great group of people. We've worked together before. I am Michelle Valley. I am also a family nurse practitioner. I own Advanced Telemedicine. We are a primary care practice, and similar, we had patients requesting to be certified for medical marijuana, asking more questions about it, and what we found is that a lot of providers are just choosing to not put in the effort to educate themselves about it. Historically, medical schools, nursing schools have not taught anything about medical marijuana, so a lot of our providers are uneducated on the topic. Luckily, that's changing. So our practice, that has become our specialty as well. So for patients that are interested in alternative health methods, they certainly could come to us and we will help them. Good news is they're just redoing the nursing boards coming up, and they're going to have questions about medical marijuana on it. So that's going to be forcing nursing schools, medical schools as well, to start putting cannabis in their curriculum. So times will be changing and people will be coming out more prepared, which is really good news for healthcare, which results to quality of care patients receive as well.
That's a great point, actually. Hi guys, I'm Brian Essenter. I'm a pharmacist. I've been working in the medical program here in Connecticut for about a little over 9 years now. I was a pharmacist for a retail pharmacy for Walgreens for about 16 years before that, so I feel anybody's pain that has to deal with your regular Western medication because it's miserable for us too. A few things. I think that talking about the education is so important. I don't know how many of you guys all heard, I know some of us have, about them attempting to take pharmacists out of the dispensaries and really losing access to those healthcare professionals right there. So these ladies and a few more like them that we're finally starting to get here in Connecticut are going to be a much more valuable resource than many of us thought that they would be when they started. This is something that I've seen coming for a long time. I went out to Oregon and saw this happening out there about 6-7 years ago now, and it's only going to continue. It seems as though we have fought and won the battle so far. They're going to take the language out from removing the pharmacist, but it doesn't mean that's not going to be a fight we're going to have every single year going forward. And that's really unfortunate. I know not every pharmacist is the most educated person in the world when it comes to cannabis, but there are certainly things that having them on staff can really do for patients, besides just the confidence of what they're getting and how they're dosing and everything. I've had certain things brought to my attention, even patients that I've dealt with that have simple allergies to terpene or a cannabinoid that they can't have in their product, that I'm right there. I can look at these products, I can look at the COAs and make sure that they're getting the right products. And maybe the prescription medication dosing had changed or something to that they don't want to sit and wait 15, 20 minutes for some telehealth provider to come on that doesn't know what the dispensary has in stock, or what type of ingredients these products have, or what dosing they've been on before. So they're really starting at square one with every single one of them. And I think that's a real disservice to these patients. And they come in there looking for us to have an idea to help them, because they know most of their providers have no idea. They just said, well, there's a pharmacist, go talk to them, because they don't want any responsibility or anything like that either. It's not the case with these ladies. They'd love to see you every month if they could, but it's the reality for most people. And even those that are in the hybrid dispensaries, you're getting questions from adult use patients more often than you are from the medical patients. Most of the medical patients, you kind of train them and send them off on their way, and they figure it out, and they'll grab you every now and again. But you get a lot more questions from the adult use customers that are coming in, that 90-some% of them are using cannabis for a medical purpose of some sort as well. So it's really important that we are involved in the care, that we are there to help the patients, and just have access. But I think it is really important that we're finally getting some education out there for the rest of our healthcare providers as well, so we can feel confident that when anybody does go talk to them, they at least have a half a clue. They might know what type of interactions to look out for, and they're not as scared to talk to their patients about it. I know for most of us at the beginning, it was all self-education. That's really sad, but fortunately, as healthcare providers, we kind of know how to find the information, the good information. It's not necessarily the case for everybody, so there's a lot of bad information out there. Now that the school is starting to implement a lot of this, your healthcare providers have some idea of the information, or at least how to find it, and are much more willing to do that. So hopefully we can keep that going.
Awesome, thanks. Okay. Well, I'll take it on a different route. I wanted to share some case studies and things that I've been working on. I hope you guys find it a little interesting. So I'm going to share two that came from the doctors group that I'm with. So this is really, the point of this is to share how you can use cannabis as medicine as an alternative straight from the get-go. So traditionally, we've seen a lot of people who've been failing or struggling on pharmaceuticals for a long time and then trying cannabis. So ideally, what we would like to see is people incorporating it right from the beginning, right from the beginning of the diagnosis or the beginning of the symptom. So Dr. Jen had called me. She said, I have a patient coming in. She's a 35-year-old woman, and she's having this acute panic situation. So situation in her life causing her acute anxiety that she's been really struggling with. It was about 5 days in. So complete despair, basically. So she said her therapist told her, call your doctor and go get some Xanax, okay? And so she called and she told, Dr. Jen that. Dr. Jen said, okay, yeah, come in. Of course, I'm going to see you, but I'm going to have you talk to Uzma. I'm going to have to do this new cannabis pharmacist. So after her checkup and her physical, she came upstairs to my office, and we had a really great conversation. She was recreational here and there cannabis user. So we talked about I taught her about CBD, I taught her about CBN. She had already had a vape that she could use in moments of panic. She was able to try some of the CBD in the office and started feeling a lot better, and left with CBD and CBN and totally forgot about her prescription for Xanax. And now she, following up with her, she had a really great week. I gave her a little bit of homework, keeping a journal, switching the narrative and the mindset, and then sent her on her way, and she did great. And so she was, again, what's really nice is then not being able to have an option other than something that's habit-forming or addictive. And I was sharing this story with a patient from CCC, actually, who had struggling with addiction and dependency of opioids and benzos. And when I told him the story, and he looked at me, and his heart his eyes changed, his heart changed, and he said, how I wish someone gave me CBD before they gave me that first Xanax. And that just like pulled my heart so much. We think this is a small thing, and here, take some CBD instead of Xanax, but really what actually happens to those of us who start using these medications and the suffering that follows. So you never know when you're going to really change the course of someone's life. Another interesting story is that a young woman had come in, she's like 23 years old, with a huge abscess in her underarm. So she had gone for a waxing, and something got infected, and her abscess was like this big in her underarm and this thick. And one of the doctors was like, I need to, she had come out from the consult room, and she's actually writing out a referral for the patient to go to see a surgeon for IND, incision and drainage. So the plan was to, of course, start her on antibiotics, and after it calmed down for a few days, to go and have this medical procedure. And that was the only way that they could treat it. And I was like, we use topicals for everything. You can put RSO on lots of different skin conditions and really get amazing results. And they looked at me like I was crazy, right? And I said, okay, let's try it if she's willing. I had a conversation with her, educated her a little bit about it, told her what it was. We put the CBD oil, the full spectrum, right on her abscess, right in the office, and bandaged her up. And the doctor started her on antibiotics, and also I counseled her that you do have to take a probiotic. For a number of reasons. Antibiotics can actually, one course of antibiotics can increase your risk of depression by 20%. It's a big deal. It's a big deal. So we made sure that she was on her probiotics. I told her, I said, okay, use the CBD 4 times a day and just keep it covered. That night, the doctor called me on my cell phone after 10:30. I was so scared. I was like, what happened? The patient had sent her a picture. It already burst. All the pus came out. All the blood came out really perfectly. She continued with the CBD. We followed up with her a week later, and it was completely clean. Totally saved her from that painful intervention, and something that we just don't normally think of, right? That you can use these things for wound healing and topicals. I just wanted to share this.
We actually had a very similarly built patient when I first started was dealing with a type of thyroid cancer that was extremely rare, had a wound that the doctors were trying to close on his neck for months, and they could not get it to close. I mean, he was completely immunocompromised and everything from all the treatment that he was going through, and he was using high-dose cannabis as it was to treat the cancer as well. So he started just taking RSO that he was making on his own and putting it on this open gaping wound that he had. And within about 6 weeks, it had completely healed over with new skin and everything. And the doctors are looking at him like, what the hell did you do? How did you do this? And he's like, no, it was just RSO. It was just pure cannabis oil that I put on there. And this is what I got from it. And I mean, it was better than any typical wound scar you would see or anything as well. It was unbelievable to see it. I mean, it stayed. It's not like it reopened on him or
it
anything.
doesn't reopen.
Days later, he had no other issues with it that I remember for years afterwards. It stayed for him. So it's not like he had to keep treating it or anything either.
I had a pancreatic cancer patient with a wound in their leg that was open for over a year, and the wound center could not get it closed, and we did it in 6 weeks. That was pretty cool.
Yeah. So
I used the one-to-one.
a little history, because I think all of us are kind of losing track of time, because I hear from patients, I've been certified since the beginning. Well, when was the beginning? So 2012, it became legal for medical marijuana in Connecticut, but the dispensaries didn't actually open until 2013. So patients were lined up getting cards with nowhere to get it from, and in 2013 they were finally able to start purchasing it. And for a while, initially, there were 17 qualifying medical conditions to get your card. And as more research is being done, we're starting to see that more conditions are being helped by cannabis. And so now the qualified medical condition list is up to 42. And who knows, 5 years from now, maybe 142,
43.
Other. It just needs to say other.
Yeah, at the doctor's discretion. We don't need any more.
Yeah, I think it should say other, and the doctor can bill it.
But it just shows that, like, with all your stories, that just made me think that, yes, it helps so many things.
Yeah.
But yeah, you're right. Most states do have other at this point, because it is kind of crazy to go down the list.
Sorry, they can get it adult use. What's the difference if you're prescribed by the doctor or certified for any condition that you're probably using it for? Sorry.
Does anyone have any questions?
You can go to the website, the DCP website, and you can submit a new condition. The thing is when you do that, you have to submit all of the studies. None of them can be animal studies at all. They all have to be human-based studies that shows how this product has been tested and proven to work for that condition. And they want them all mostly from the US too. It's hard to use others. But that's the problem, is when you're going for, at the doctor's discretion, I don't have any studies to put up for that. There's not a specific, condition for that, and that they don't know what to do with that.
And do you know if doctors have, do physicians or any practitioner have sort of a malpractice exclusion, because cannabis is really federally, that if you're prescribed something, and I mean, no it's exactly right, but is that a concern in?
Two things. So great question. But the number one, their DEA number is issued by the state of Connecticut. So even though it's federal and all that other stuff, Connecticut also descheduled it to a Schedule 2. So it's no different than them prescribing, Percocet. But they don't prescribe in Connecticut, they certify, because prescribed's been defined federally as, for a medication that's been approved by the FDA. So they can only certify, which is why you only go back once a year, and there's not all the other stuff as well.
I can ask another question. Yeah. What about reciprocity with other states?
Into Connecticut, no. Out of Connecticut, Rhode Island's the only one in the Northeast that does reciprocity.
So what would that take in Connecticut to allow that?
You were there Thursday, come on, man.
Well, that's it.
They don't, it's no control for them because other states have at the doctor's discretion, they don't like that. You could have anxiety and have a card in another state, and they are very uncomfortable with that. Yes. Spectacular website. Cannakeys is the name of the website. It's CANNAKEYS.com.
It's run by Dr. Igor Bleshing, and it's a plethora of over 6,000 research studies where you can find dosing and...
It links the studies to the condition as well. So you can put the condition you're looking for, and it'll give you the studies. It'll tell you if they're placebo, randomized, double-blind, or if it's animal studies, or what have you.
It'll also tell you like the type, like CBD was the one.
Yeah, chemobar, chemotype, yep, absolutely.
and breaks it down to chemotypes.
Yeah.
Yeah, it's a great website. It does require a paid subscription. I think you can get like a week free or something to try it, but I belong to the American Cannabis Nurses Association, ACNA, and by being a member of that, I get a discounted rate to Cannakeys, so you can also kind of see who's related to who to get a discount, but I think it's well worth the money because yes, it 100% is the most reputable database to see actual reliable studies.
So I'm going to bring up a patient case that we were kind of brainstorming on before the session started. So I am, even though I'm a family nurse practitioner, my experience with pediatric patients really kind of expands only to primary care, and I've never treated pediatric patients with cannabis thus far. And so I was talking to Ryan and Uzma about a patient case. I had a patient's mom contact me last week. This is a 15-year-old boy who recently developed a seizure disorder that they can't seem to really diagnose or kind of classify right now. They're not sure if it's epilepsy or something else. But mom is hoping to get him off of the Keppra. They have him on a pretty high dose of anticonvulsant, and he's having some side effects from that. But also she had been doing a lot of reading about CBD and its role or potential benefits for autism, because he's got severe autism. He's nonverbal. So that's another factor of the story that I maybe hadn't talked about earlier. But so I was hoping to get your kind of, some information about your experience in working with pediatric patients. I asked whether it made sense for him to get a medical card in Connecticut or not.
All right, so what we were talking about is that, and then I related it to my current 7-year-old who was dealing with seizures, and we started about 2 weeks ago, and they're seizure-free now, going back to school next week, which is really exciting. She's 7. So your patient is 15, and he said that he was taking Keppra, and mom was asking if she should start decreasing the Keppra and adding CBD, right? So what my response is that what I would do is first start incorporating the CBD without touching the dose of the Keppra. Probably doesn't need a medical card, and I would just start with minor cannabinoids, and if further down the road we felt like we weren't seeing the results we were looking for, then we'd consider adding like say THCA or THC. So really the idea would be to start the CBD, go over titration to get to the dose, the target dose that we want. With pediatrics and with epilepsy, it is one of the few conditions of cannabis that we do dose out milligram per kilogram, so by weight. And getting the child to a point where they're relatively seizure-free or hopefully completely seizure-free, and then speaking to the doctor and the parents about slowly, possibly coming off of the Keppra. And that's really the process that I would take.
Yeah, I think that's great. I think the one concern that I have and that I think most of us should have, especially if you're doing this with over-the-counter products, is they still need blood testing because CBD can adjust the levels of Keppra. So, you know, if they end up with adding the CBD and as you titrate that up, you could end up with higher levels of Keppra as well, which is a drug that has a very slim therapeutic index. Just means that it fits between this margin and it goes out of that and you have problems. So you don't want any of these kids having more side effects or potentially additional seizures or anything like that. So, you know, even if you're adding CBD over the counter and thinking, oh, this is safe, this isn't a problem, there are some of these medications, especially even for kids, that you have to really be careful with. You know, I agree with Uzma 100%. Don't touch the Keppra because you'll figure it out very quickly what's happening. When you do, especially you know, nonverbal kids that can't really say, you know, oh, I'm feeling different, or I don't like this, I do like this. It's more just your visual cues. That's something that you really need to pay attention to, and when it is best to bring in a healthcare provider that knows what they're talking about and doing. But my bigger point is, if you think you can just do it on your own, there are some of these really potent drugs that have very small therapeutic windows that can be affected by CBD and not really affected by THC to speak of. So as much as we think CBD is safe and no problems with it, there can be some major complications you have to be
Like
careful.
CBD is safe, it's the pharmaceutical that's unsafe.
Right, yes, exactly. I mean as far as no interactions or potential interactions there. CBD is safe, not saying that. I'm just saying there's potential for it to lead to some other issues.
And regarding autism with the child, I'm currently treating a young adult with autism. We've seen really, really good results using a wide range of cannabinoids. So whenever I have parents and they tell me that their children are Keppra, or even adults that are on Keppra, it really causes changes in personality. Like Keppra is just known for Keppra rage. And then you're dealing with the autism, so what kinds of issues or behaviors is the child displaying? And is there a lot of anger? And is there a lot of, acting out or repetitive actions? And then maybe timing some of those CBD doses with the times of day that maybe some of these behaviors arise to hopefully curb those behaviors. The child isn't sleeping well, and you can time maybe use some CBN with the CBD to help with a deeper sleep. And that, the amount of milligrams in the 24-hour period would add up to that target dose to work on this issue.
Would your dosing, like if he just had autism without the seizure disorder, would that determine your dosing kind of one way or another? You're saying it was milligram per kilogram for the epilepsy or for the seizure disorder. What about?
So if he's like at 15, he may be like a full-grown young man. So I would have to do that like case by case. So if he was kind of maybe slower in development, also hormonally, and not really like gone through puberty, I think I would probably be cautious and start off with a milligram per kilogram. But if he's like almost like a young man, then I think I would just go for like a regular kind of dosing.
So I think Brian had mentioned the abbreviation COA. So I think that this is kind of something also that's important to just know if you aren't familiar with that term. It's certificate of analysis. So cannabis right now is not FDA approved, so there is no chemical testing required by people supplying it. But to be sold in a dispensary, you have to show a COA, certificate of analysis. So anything sold in a dispensary has to be chemically tested to prove that it is what the label is saying it is. So that's a benefit of getting products from a dispensary, whether it's medical or adult use. But the issue is limitations, especially with all the cannabinoids. You know, a lot of them sell what's popular, maybe not what's necessary. So if you are to get these products from an outside source, you want to really make sure you know where they're coming from, because there's a chance that they don't necessarily match with what the label's saying.
Yeah, sourcing products is probably the most important thing of anything when you're consuming cannabis. I mean, if you go to the dispensary, you can be pretty confident that, you know, I mean, here in Connecticut, we may have the highest mold limitations of anybody. That's a problem. But in general, we're tested for, you know, heavy metals, pesticides, you know, mildews, all that kind of stuff as well. So you know that the products are clean and what they're supposed to be. We also have potency testing, which I think is one of the most if nothing else, it at least gives you an idea of how much you should or should not use. Just because it's more potent doesn't mean you need to smoke the same amount to get higher. That's not really the point of medicated. So having that's the one thing that I miss when I go to the gray market or wherever else. I mean, I enjoy those as much as anybody, but I want to have an idea of the potency. And you know, you don't get the cannabinoid profile or anything either. Yeah, I can use my nose and it's pretty tuned in at this point, but most people don't have that option and really would like to know what it is that they're putting in their body. And you know, like I said before, some people have allergies to certain terpenes or certain cannabinoids or something as well. So, you know, to have that information can be very vital, especially on a medical level. If that's not an issue for you, well then, you know, so be it. But I think it's really important, especially when we're dealing with, you know, kids, you know, people that, as Uzma said, everybody that is in the medical program is because they have not been helped through your typical Western medication. They are the extreme cases that, you know, if they had been stabilized by typical medication, you wouldn't see them. They're fine. They're good. They have no other problems, but they're not. They haven't gotten that relief they're looking for. So you have to be very cautious of what you're doing and how you're doing it, and titrate everything, because, you know, if you don't, you can have somebody in a place they're not interested in being, and they could end up never touching the medication again, and that could be really unfortunate. Yes, please, sir.
I had a relative come to me recently and said, hey, you're in the weed business, tell me what I can do about my critical loss. And I said, look, I asked if I can. But I said, you haven't tried anything? And she said, I've tried CBD and edibles, but they hurt my stomach. And I don't really smoke. So could you talk about delivery, form factors, delivery mechanisms? Can you start somebody on, say, vaping and then move them to something that's more like a tincture? What have you seen in people who at least have an issue with either, say they got all the lung thing, and they're not going to smoke? Okay, so you talk about form factors and delivery mechanisms.
Yeah, so edibles are really the best thing because you're getting more local absorption in the system and in the lower gut and whatnot. So the question is, how do you get it there without it upsetting your stomach? There's a lot of ways that you can do that, but my first reaction would be to just avoid it altogether and use something sublingually, you know, tinctures or something along those lines. And, you know, chewable tablets are sometimes a little easier, but, you know, you could do something like an RSO that you just put on a cracker or something like that. I mean, there's oil capsules, stuff like that. I know swallowing is not easy in a lot of those situations, but vaping is going to be good, but it's immediate, it's quick, it can be breakthrough pain, upset, you know, kind of a thing. It'll help with some cramping. CBD, CBN would really be best for that, more than the THC would be typically. But, you know, CBD is really one of the best things for IBS. And then if things are more the other end, and it's more rectal that is the issue, if it's more of a Crohn's or something along those lines, you know, THC is definitely better for the pain that is there. I don't really recommend suppositories because suppository, it's a water-soluble environment, and cannabis is fat-soluble. So if you're putting a fat-soluble substance, you're going to get maybe 10-15% absorption. But you will get local relief, you know, just like you using a topical or something like that. So, you know, you can use it both ways to get the relief there. Sure.
So I would do it a little differently.
No.
I'm a beekeeper. There's an old saying in beekeeping, you ask 5 beekeepers a question, you get 10 answers.
Yeah. So I think that depending on the severity of the symptoms and if they're willing to vape, vaping would be for the as-needed breakthrough symptoms. I agree with Brian, that would be great. When you feel that stomach cramping and you're like, I have to go right now, the vaping is really effective. I would also recommend a sublingual. So I would recommend probably about CBD 40 milligrams in the morning, probably in the afternoon again with consistency. And then about the tolerance, I like to use THC also. Sometimes people don't want to be high, so maybe just a 5 milligram capsule at time of sleep, you sleep it off, but the THC works all its magic in your body and you don't have to deal with the disorienting effects. That can generally, 10 days in, can really turn around someone's IBS. You're supplementing the endocannabinoid system. And IBS is really related to endocannabinoid deficiency. It ties together IBS, migraines, and fibromyalgia. Now, I'm actually a huge fan of treating patients with suppositories, rectal suppositories, and I've seen really amazing things happen with it. So if patients with Crohn's or colitis, and even sometimes severe IBS, if the symptoms are so severe such that there is bleeding, to start leading to like anemia and like food nutrient deficiencies, that's a good time to use the suppositories. And so you are getting, so I wasn't using this, I didn't really use the suppositories on patients for a couple of years because I was kind of waiting for some more hint of proof that where is it going? Because we did, like I used to think exactly what Brian's saying. And then there was a podcast and it was some type of scientist like out from like Eastern Europe. And his theory, based on his research and his experience with it, is that when you use a rectal cannabis suppository, it gets absorbed into your lymphatic system. And that could be one of the reasons why you don't get high or you don't get a psychoactive effect. Nonetheless, whatever the theory is, I firsthand worked with the rectal and vaginal suppositories enough times now that I'm completely convinced that they are just, it's like a miracle. So if the symptoms are severe enough, as I said, bleeding and some other things going on, then I would recommend probably a 1-to-1 THC CBD. We could decide the milligrams. A suppository probably for 10 days or 7 to 10 days straight in the
Yeah, it's also occurring to me that you can't formulate these form factors if they don't already exist.
Very frustrating. Well, the suppositories I teach people how to make them like via FaceTime. So you get the RSOs and then we do the, you work with the math and I do the recipe for them. So that
But there has to be at least a challenge in Connecticut with the lack of.
it's awful.
Suppositories are outlawed in Connecticut.
Yeah.
Specifically says you cannot make suppositories for the medical program or